It's too risky to let the Pakistan men's cricket team train while in managed isolation. That's the Director General of Health's conclusion after 10 team members have tested positive for COVID-19. It means they'll have a little more than a week to train before their first T20 match against the Black Caps on the 18th of December. That's if all of them are let out. As well as positive cases, the team also broke managed isolation rules by mingling during their first few days. Dr. Ashley Bloomfield says that means there's a chance of the virus spreading if he grants them a training exemption.
Ultimately, I've got the responsibility for the overall public health, and so including in the community. And so I just felt on balance there was that residual risk, and that it was safest not to have any training for the period of their managed isolation.
All things being equal, they would do 14 days isolation and they would have been due out around, I think it's the 8th of December, which would be about Tuesday of next week. Is that going to happen? Will the whole team be released at the same time, or what's going to happen?
The vast majority of the team are on track for being released then, all going well with the day 12 testing, but there will be some who are close contacts of those original cases, the ones that we've already identified, and they will need to stay through for a full sort of 14-day period. And the ones who are cases need to have spent at least 10 days and been symptom-free for 72 hours before they can be released.
So some of the squad won't make it out?
Not immediately, but the vast majority of them are on track for that, all going well for the remainder of their managed isolation. And I should say there is a reasonable period of, I think, somewhere between 8 and 10 days before their first match for them to train once they've finished managed isolation. So
worst case scenario, how long will the longest stayer from the team be in managed isolation? Based on your current infections? Well,
based on the current infections, if there were any close contacts of the person identified at day 6, then those close contacts would need to stay for a full 14 days from that point in time. So there may be people who are in there till day 20, but I'm not sure if there are any close contacts, given that, again, after those initial breaches, at the start of the stay, I think that there's been a much higher level of compliance, or they have been compliant with the requirements.
Anyone else showing symptoms?
Not at this point, but of course, in addition to the testing, day 9 and then day 12, there are daily symptom checks as well. So far, so good there.
Do you think that the tests that were taken beforehand were accurate, given the high numbers of infection?
Well, I can't really comment on the accuracy of the tests done before they came, but I can on the accuracy of the tests that we do here, and I think we've got fantastic testing capacity, and also our labs are doing a great job of identifying all the cases that arrive.
Do we need to change anything in terms of how we're managing these teams coming in?
Look, I think the main thing, perhaps that this particular incident emphasises is that the obligations on anyone travelling to New Zealand, whether they are Kiwis returning or whether they are sports teams here with the potential for a training exemption, is that there are really strict criteria and strict obligations on them that the expectation is there they'll comply with. And that is for their own safety and health, not just the health of the workers there and the wider public. So I think this really emphasises the point.
But do you need the hassle with this? Not to put too fine a point on it. These are not critical workers. They're not surgeons. They're not delivering necessary health care. They are professional sports people, and they seem to be taking up a lot of time and resources. Should we be bothering with it?
Well, I think we've got a very good process now for getting these teams here, for seeing them through managed isolation. I think that our health and other staff down in Christchurch have done a fantastic job with a range of teams this year, and that has meant we have had the opportunity and privilege really of watching live sport here in New Zealand. I think people appreciate that, but so saying, they also expect the teams coming here to to live with the rules and to play their part, and that's certainly our expectation.
So is it worth it, do you reckon? And given the time of yours that it's taking up as well?
Well, we're all learning to do things in this very different environment in 2020, and this is one of the things, again, I think we're fortunate as a country we can entertain these sorts of options and having live sport. So I think it's worth it. It's particularly worth it if it all goes smoothly. It doesn't always go smoothly, but we're certainly used to making good decisions and keeping people safe.
That was Dr. Ashley Bloomfield there.